Last month, a 34-year-old teacher suddenly developed what she described as the worst headache of my life during a staff meeting. Her colleagues, well-trained in FAST, looked for facial drooping, arm weakness, and speech problems. Finding none, they suggested she take some ibuprofen and rest. 3 hours later, she collapsed from a massive subarachnoid hemorrhage. This isn't an isolated incident, it's a systematic blind spot in how we teach stroke recognition. When FAST, face, arms, speech, time was introduced, it revolutionized public awareness. Suddenly, everyday people could recognize strokes. Emergency room visits for strokes increased, and door-to-needle times improved dramatically. But FAST has a problem. It only catches about 80% of strokes. Recognizing FAST's limitations, the medical community introduced BE FHAST, adding balance, sudden loss of coordination, and eyes, visual disturbances. This was brilliant. Posterior circulation strokes affecting the cerebellum and brainstem often present with dizziness and vision problems rather than the classic FAST signs. BE FHAST caught these previously missed strokes, but we still had a gap. Here's what the data tells us. Hemorrhagic strokes. 97% of subarachnoid hemorrhages present with sudden severe headache, and 85% of intracerebral hemorrhages include headache, often described as thunderclap or worst headache of my life. Posterior circulation strokes, 60% of cerebellar infarcts present with headache, 80% of vertebral artery dissections include severe head, neck pain, and 90% of basilar artery occlusions with brainstem involvement. Even anterior circulation. Large MCA territory infarcts often cause severe headache, carotid dissections frequently present with head, neck pain, and hemorrhagic transformation can announce itself with sudden headache. Yet our most widely used mnemonic ignores this critical sign. Introducing BE FHAST. It isn't just another mnemonic, it's the completion of stroke recognition. Balance, sudden loss of coordination, dizziness, eyes, vision loss, double vision, visual field cuts, face, facial drooping, numbness, uneven smile. Headache, sudden severe headache, often described as worst of life. Arms, weakness, numbness, drift. Speech, slurred speech, aphasia, dysarthria. Time, note onset time, call 911 immediately. Why this matters now? The stakes are higher. Stroke affects someone every 36 seconds in the US. Every minute of delay destroys 1.9 million neurons. Early recognition can mean the difference between full recovery and permanent disability. The demographics are changing. Strokes in younger adults are increasing, and hemorrhagic strokes are more common in younger populations. These strokes often present with headache as the predominant symptom. Current training falls short. Most public education focuses on FAST, and healthcare providers often use BE FHAST. Neither adequately prepares people for hemorrhagic presentations. Consider these scenarios. Scenario 1. A 28-year-old suddenly develops severe headache and mild dizziness at work. FAST is negative. BE FHAST possible, but BE FHAST positive. Result, earlier recognition of vertebral artery dissection. Scenario 2. A 45-year-old experiences the worst headache of my life while exercising. FAST and BE FHAST are negative, but BE FHAST positive. Result, earlier recognition of subarachnoid hemorrhage. Scenario 3. An elderly patient has sudden severe headache with mild confusion. Both FAST and BE FHAST are unclear. BE FHAST positive. Result, earlier recognition of intracerebral hemorrhage. Implementation strategy for healthcare providers. Integrate BE FHAST into stroke protocols, update educational materials, train nursing staff and first responders, and include it in medical school curricula. For public education, social media campaigns, community health presentations, school nurse training, and corporate wellness programs. For families, teach the complete mnemonic, emphasize sudden severe headache, practice recognition scenarios, and keep emergency numbers accessible. The pronunciation question, BE FHAST, is pronounced BE FHAST, with emphasis on the F and H being separate components. In training we recommend saying BE FHAST to ensure the headache component isn't missed. Addressing concerns, won't this create more false alarms? We're looking for sudden, severe headache, not typical headaches. The key descriptors are thunderclap, worst of my life, or completely different from usual headaches. Is it too complicated? BE FHAST has the same number of letters as BE FHAST, but includes a critical component. Medical professionals already use 6+ letter mnemonics successfully. What about the evidence base? While formal studies comparing BE FHAST to other mnemonics haven't been conducted, the clinical rationale is sound. The components are all established stroke symptoms with strong evidence bases. The path forward, BE FHAST, represents the natural evolution of stroke recognition. It builds on the success of FAST and BE FHAST while addressing their limitations. By including headache as a core component, we create a more complete tool for stroke recognition. The goal isn't to replace what works, it's to complete what's missing. Every stroke mnemonic evolution has saved lives. FAST gave us public awareness. BE FHAST gave us posterior circulation recognition. BE FHAST gives us hemorrhagic stroke awareness. It's time to complete the picture. Take action. Share this article with healthcare colleagues. Teach BE FHAST to your family and friends. Advocate for inclusion in your institution's protocols. And follow our educational content for more medical insights. Remember, if you see any sign of BE FHAST, call 911 immediately. Time is brain tissue. About the author. Doc. Medical disclaimer. This educational content is for awareness purposes only. Always seek immediate medical attention for suspected stroke symptoms. Call emergency services immediately if any stroke signs are present. Connect with us on YouTube, Instagram, TikTok. References for this information are provided below. This video was created with assistance from Claude A and Gemini. Don't forget to like, share, and subscribe for more medical insights.